is one of the best diagnostic tools, has retained its popularity in the entire population because of its ease and fast diagnostic criteria. It can scan your body in no time. We are not doing pulse diagnosis only because of the fear of the difficulty of pulse diagnosis. Though it is the easiest diagnostic tool, the the earlier Vaidya had made it more complicated and difficult to understand. It is a simple diagnostic tool which can use only 3 fingertips of the examiner on the pulse of the patient and gives you the entire diagnostic criteria. This simple tool was lost because when the CCIM syllabus was decided, this was kept out of the syllabus. So neither in BMS nor in MD this course has been ever taught. It just takes your 3 fingertips and the wrist of the patient. If you can mix them together and bring them in a proper way, you can diagnose it very properly. The important phenomena of diagnosis is keeping the fingers on the right place on the wrist. So the easiest way is to just pass your fingers on the side of your arm and find an elevated portion as styloid process. Go medially towards the wrist and you can find pulsations there. Keep your 3 fingers together on the arm of the patient in perpendicular fashion in 90 degrees and then just examine the pulse. The pulse can be examined in 5 different levels named immediate expression, superficial expression, deep expression, subdosha expression and dhatu expression. These expressions gives various amount of knowledge about happening in the body. Like immediate expression tells you about the gross happening in the body, in which part of the body the disease is occurring. Secondly, whether the heart is involved or not, whether the ama is involved or not, or whether the disease is acute or chronic, and what is the intensity of the disease. When you go to the superficial level, what you get is the dosha condition of the body. Index finger there denotes vata sthana, middle finger denotes pitta sthana, and ring finger denotes kapha sthana. In that, if it is sarpagati, it indicates vata activity, mandukgati indicates pitta activity, and hansagati indicates kapha activity. So we can identify in which sthana which dosha is more activated. Then you get the understanding about prakriti in the deep level of the pulse. The deepest portion of the pulse gives you an information about the prakriti of the patient, where index finger tells you about vata, middle finger tells you about pitta, and ring finger tells you about kapha. The intensity is equivalent to the dominance of the dosha in the prakriti. While in subdosha level, when you are examining the pulse of the patient at 1/3 level within the pulse, you get the information about the activity in various organs known as subdosha. Like in index finger, it is divided into 5 places: vat, pran, udan, saman, apan, and if it is more than one place, it is vyan. Likewise, in middle finger, it is pachak, ranjak, sadhak, alochak, and if it is more than one part, it is bhrajak. Likewise, in the ring finger, it is kledak, avlambak, bodhak, tarpak, and if it is more than one part, it is shleshak. And the last portion is about the dhatu level. When you put your fingers on the 2/3 level in the pulse, what you get is the dhatu level, where index finger tells you about asti dhatu, middle finger tells you about rakta dhatu, ring finger tells you about rasa dhatu. If it is index and middle, it is mausa dhatu. It is middle and ring, it is meda dhatu. If it is on the 3 fingers, it is majja dhatu. And if it is on the index and ring finger, it is shukra dhatu. If you combine all this information together, you can end up into diagnosis. You can always easily diagnose any disease out of this information. There is no need to remember every disease's pulse. This particular modular program of pulse diagnosis is easy to understand, easy to practice, and easy to replicate. and this phenomena gives you an understanding of whether the physiological condition or the pathological condition of the body. Thank you.